Welcome back. Just before the break, we brought you a new report looking at the numbers of people who report excessive drinking. For example, locally, a study found 23% of respondents living in St. Johns County reported excess drinking. As we recognize Alcohol Awareness Month, we want to bring in Kaitlyn Pettyjohn. She's the clinical director at Lakeview Health Treatment Center, joining us. First of all, thank you for coming in. Good morning. Not a lot of people like to talk about this, right? Because there can sometimes be a fine line between enjoying some libations and going too far. Kaitlyn, what does alcohol abuse look like?
So I think that there's some misconceptions, that, people really are looking day to day at what they're doing, and one or two drinks, I think, is there's a lot of, focus in on that, but it's really when that use starts to really affect your life that becomes abuse, right? And so we use the DSM typically to diagnose that, but it really is something that when you're taking a look at the full picture of your life, it's impacting your job, your finances, your relationships with family. It's really how that is interacting more so than just what the amount is.
Absolutely, absolutely. So what trends do you see? I mean, are things changing? Alcohol's been around forever. We know that practically. Are things changing nowadays, or?
I would say so. I mean, I think when we kind of look at some of the trends going on is, I think with the younger population, alcohol use is declining, actually. I mean, I think we've even seen, dry January come up recently. And I think people take that and they realize the positive effects that it has on their lives as having a dry January. But we're also still seeing, an increase in liver disease and other health-related issues with alcohol. So as much as we're seeing that decline, we're still seeing the health risks, right? And so I think that really circles around, maybe less people are drinking, but there is an increase in what they're drinking.
Sure, sure. So that may mean it's time to reevaluate our relationship with alcohol. Where do you start with something like that? What are your best suggestions?
Yeah, so some of my suggestions would just be taking a look at how you're drinking, right? Am I drinking when I am stressed? Am I drinking when I've had a really bad day? Am I just drinking to enjoy or relax? It's just really dependent on how you're drinking and how that impacts your life as well. So just examining that relationship, how it's impacting us, and kind of going from there as well.
And changing the relationship.
Yes.
And looking at it, and maybe breaking up with alcohol altogether is best for you.
Yeah, and that's dependent on person to person. I think there's also another misconception that we have to hit our rock bottom before we start changing that relationship, but we're seeing more and more, that there's something called like pre-addiction. So we can really, start looking at that earlier and earlier on, and making those changes so we don't have to hit our rock bottom anymore. We can make those changes early on and look at that from a recovery perspective.
Yeah, and Kaitlyn, you and I both know that sometimes people aren't able to see the problems themselves. Yeah. It's their loved ones, right?
Absolutely.
It's a spouse, it's a child, it's a parent that says this is just not healthy anymore. What do you recommend when it comes to them? Because that's a sensitive subject. That's a sticky subject.
That's really hard. I mean, obviously, I think our behaviors is hard to see ourselves, like you mentioned, and so for family members, just getting help from those around them, continuing to be gentle with their loved ones, maybe attend Al-Anon meetings as well to kind of give them an idea of extra support in the community as well, and how to address those loved ones, and just slowly kind of mentioning that to family members a little at a time, without being too overwhelming for them.
Absolutely, and as it says on the bottom of the screen right now, you can go to lakeviewhealth.com for more information, and maybe if you have to get that help from a professional, that's a good resource.
Absolutely, yeah. So I mean, I think inpatient treatment is something that can be a great resource for anyone, and there's other resources on our website as well as for that.
Kaitlyn, thank you, and thanks to your team that works around the clock to make our community safer and healthier for everybody.
Absolutely, thank you so much.